In the last 20 years, the business model, hospitals trying to make money, competing for patients, insurance companies trying to make money off of us, we become more of employees rather than independent practitioners. And as a result of that, we have managers, and the managers are starting to put pressures on us. You need to be more productive. You need to have, I get a score every 3 months telling me the number of RVUs per hour that I produce. Okay? And if I'm in the lower half of my group, I need to pump that up. I need to either do more tests. I have no control over the number of the kinds of cases that come into my emergency department, but I know that I can pump up my RVUs per hour by doing more tests. So a chest pain that I think is an inconsequential chest pain becomes an important chest pain if I do a whole series of tests, and that pumps up my RVUs per hour. Do I do it? I hope not. Am I pressured to do it? You bet. You bet. And so the pressures are there, externally placed many times by business people who have imposed their will upon healthcare and are pressuring us into more of a business model. And I think it's damaging to the interaction with patients as people, and it changes how fundamentally who we are. Because everybody's always said doctors are not good business people. That's a good thing. That's a good thing. We shouldn't be good business people. It's not a business. It's about caring.
In the real world, this is how this works. Let's say you bring your son to the emergency room, he hit his head, maybe he was confused for a few moments. Your expectation is, I'm going to get a CAT scan. My choices are two. I can either just order the CAT scan, which adds to my RVUs, or I can engage you in a time-consuming, sometimes awkward conversation about why I wouldn't get a CAT scan if this were my son, Nick. In the end, I'll offer the CAT scan anyway because, after all, it is your child. If we don't get the CAT scan, I've accomplished three things. I've increased my liability, albeit small. I've taken more time, which stresses everybody, and I get paid less for the encounter. Why I continue to have these conversations with people just doesn't make any sense.
There are a few scoundrels out there, but most doctors see a sick person in front of them, they want to help them get better. I think that's true. But I want to talk a little about human nature here, okay? You're the kidney doctor, you're giving the patient dialysis, and by giving them an EPO shot, you can get paid even hundreds of dollars more. If it's a close call and one decision's going to raise your income and one's going to not, maybe you're going to make that call and say, okay, give them the EPO shot. Even more dramatic in the case of a heart specialist who's doing a cardiac cath, they're shooting dye through the coronary arteries to see if there's a blockage. They see a blockage there. Now, this latest study would say if they have chronic stable angina, you stop right there, pull the catheter out, and you start medications, diet, and exercise, and they'll do just as well. But it's just human nature. You're sitting there, you've got the catheter in there, and you can reach over and get a stent and put it in about 90 seconds and get paid $2,000 for it. No one's going to put one in that they're sure it's unnecessary, but what if you're sitting on the fence? Human nature says you're going to reach for that stent and make the extra $2,000.
We're done, Dan.